very tough. That's your pericardium. And as you know, body cavities are generally lined with a membrane, and we call that parietal, whatever the membrane is. In the case of the heart, it sits in the mediastinum. Remember, the mediastinum is that depression in the thorax. So it sits in the mediastinum, and it has its own covering. The membrane is not in the mediastinum, it's actually over the heart. And this fibrous stuff that I'm cutting through, that's called the fibrous pericardium. Now, it turns out that this is a double-lined membrane. So if you could separate it, then you'd have a very thin inner lining. That would be your parietal pericardium. But for our purposes, you can just say fibrous pericardium, because it's all stapled. I don't know why they staple them all over the place like that. It's all together right there. It runs right along the base of the heart, so we can just cut along here to get it off. You need to remember it, because I'll get a heart with one for the exam. Your visceral pericardium is on the heart. That membrane there. That's your visceral pericardium. It's also called the epicardium. So you can use either term, that would be fine. Epicardium or visceral pericardium. You can clear off the fat. Somebody said they mentioned something about the fat, that the cow was eating too much, what, margarine was it? Mm-hmm. The margarine that the cow eats in this case is good for the cow. It is not the one that gets into the vessel and causes clogging. This is what keeps the heart insulated and warm and keep the temperature more or less constant. And because of its position, if you get a blow to the chest, for example, the fat absorbs a lot of that shock, so it doesn't, the force doesn't get to the heart as easily. So it's a protective mechanism. And it's not just the heart that's packed in fat. When you go inside the cat later, you'll see the kidneys are packed in fat, the bladder, the viscera, all the visceral organs generally are packed in fat for that reason. So this is just to get rid of the excess. And these are the two vessels I was trying to clean up and make sure they're there, because sometimes the butcher, I don't know who they buy these things from, but sometimes they just chunk them all off. We don't have anything, we just have openings. But so far, all the ones that I saw earlier on, they have the brachiocephalic and the left subclavian. This vessel here is your aorta. That's the red one right here. And these are the branches that are coming off it.
Can you point to the aorta again?
Just a minute. This is the aorta, and these are the branches. So, here's mine. You can see mine. This is the descending aorta. You can see where it starts to descend there. That's the mouth of the aorta. So you only, that's the aorta here. That's the aorta there. Those are the branches of it. Yeah. Okay, I think this is pretty clean. Alright, so if you could get your heart, then you can see what I'm pointing to. Oh, can you lend me that model, please? I need a pointer. Jennifer, can you get me a pointer? One of those wooden handle ones? They're in the beige. They're in the beige one. A wooden handle. Mm-hmm. No, the beige. Yeah, to your right. Yeah.
No,
Nothing in there?
not with wood.
No wooden one? Any red one or black one? A black handle? Something with a pointer. That will do. Alright, so the first thing you do when you're doing the heart is to locate the front of the heart from the back of the heart. If you don't do that, you'll get everything all confused. So you need to be able to tell if you're looking at the front of the heart or if you're looking at the back of the heart. And there are landmarks on them. It is a very distinct depression that runs northeast to southwest. It's diagonal, it's not straight, it's this one. Here it is right there. So that creamy yellow thing in the background, that's the depression, that's the sulcus. And in that sulcus you can see some blood vessels there. We are not going to do the blood vessels on the real one, we'll do the blood vessels on the model. But you are responsible for the sulcus. This is called the anterior interventricular sulcus. By the way, you have a list, so I'm going by your list. This is your anterior interventricular sulcus. And it tells you a couple things. It tells you that you're on the front of the heart. It tells you that you're separating the right ventricle from the left ventricle. And it tells you that it's a depression. That's what sulcus is. If you flip the heart around, you will see a north to south line. You can see the yellow, the creamy, that's your north to south line. That's your posterior interventricular sulcus. Here it is, posterior interventricular sulcus. What the sulci, what they do is they tell you where the ventricles stop and start. So the left ventricle starts here and it goes all the way until it bumps into that. So all of this is the left ventricle. And you'll notice that the apex, the pointy part, is all in the left ventricle. There is no apex on the right side. The right ventricle starts here and it goes until it bumps into the posterior interventricular sulcus back here. So anywhere along here, if I stick the pin anywhere along there, that's right ventricle. Speaking of ventricles, you have chambers. The ventricles, you have 2 ventricles and 2 atria. The chambers are where the blood, when it comes from the body, they collect in those spaces. There's the ventricles and the atria are spaces. See, like that's the atria, that's a space in there, and these are the ventricles. So we're just looking at it from the outside. This is the left ventricle, and because you're looking at the heart, you've taken it out of the body, so you're facing it, you're looking at the mirror image of it. If you put it back in the body position, then your left side and your left side, your right side and your right side. Once you turn it around, it's still the right side, but now it's facing your left, yes? So this is your left ventricle, which is facing my right. Remember, it's mirror image. This is my left, so this is the right ventricle facing you when you're looking at it from the front. When you flip it around and it's in the anatomical position, then the right side is the right side, the left side is the left side. Yes? So those are your right ventricle and your left ventricle. Once you locate the right ventricle and the left ventricle, you can find the atria, because they are going to be above the ventricle. So this one here, this thingy here, is your left atrium. You will also see the term auricle used to describe it. Auricle literally means ear-like structure. So this is your auricle as well. When you cut open this, you will see a space inside, and that's really the atrium. So because they're basically one and the same, they use the terms interchangeable. So if I put a pin in there and you say left atrium, that's fine. If you say left auricle, that's fine too. Okay? But if you have a gun to your head, the difference is the atrium is the space. The auricle is the outer muscular portion. This is the right auricle, or the right atrium, and it tends to be pushed to the back because of the vacuum packaging. And so if you look at this model, you see the left atrium over the left ventricle, and there's the right one right where it's supposed to be, right over the right ventricle. Here is my right one all the way around here. There's my right ventricle. You would think it would be sitting right there, but it gets squeezed to the back. So sometimes you have to look a little bit around to see it. So those are your 4 chambers. Now, the next thing you do, once you again be comfortable with looking at the front versus the back. Once you know those, then you're going to try to locate the vessels on the base of the heart. You don't have any colors on these, so you're going to have to use the position that you're learning. So, the first one you can see there is that blue one. And you can, this is the right ventricle, and you can see it's coming right out of the right ventricle. If you make an imaginary line, this is your sulcus. If you make an imaginary line that's parallel to the sulcus and follow it, it will take you to that vessel right there. So if we do the same thing on our real heart, that's your sulcus. Make an imaginary line beside it, and at the top of it, you'll see a vessel. That's your pulmonary trunk, or your pulmonary artery. Doesn't care how it looks, it's still going to be your pulmonary artery, because it's coming, it's draining, it's collecting the blood from the right ventricle. Can you see it?
This little piece right here.
That's the back of your heart there.
Oh, that's why.
There's this is your heart in misshapen. Yeah, that's the one. Ew, you have a terribly shaped heart. Christ.
That's why I was confused, maybe.
But that's your pulmonary trunk there. Okay, so once you find your pulmonary trunk, I'll take that from you when I'm done and give you this one.
Okay.
Once you find your pulmonary trunk, you are again going to try to find this big red one. And you're going to look right behind it. So this big red one is this one here. That's your aorta. Oh, by the way, the pulmonary trunk has two branches. You see those? They are the right and left pulmonary arteries, and they're going to take you to the lung. So the blood is going to be pumped from the right ventricle into the pulmonary trunk and then to the right and left lung. On your real heart, you're not seeing these two branches because they cut them off right there. So what you're seeing is just the trunk area. So if I put a pin in there, you say pulmonary artery or pulmonary trunk, that's fine. But specifically the arteries are the two branches. Notice it's an artery and it's in blue. This is the exception to the artery and vein rule. Veins are usually in blue and arteries are usually in red, except for the pulmonary artery and the pulmonary vein. And the reason for that is the pulmonary artery, well, the reason is that arteries take blood away from the heart, veins take blood to the heart. It so happens that this one is leaving the heart and is taking deoxygenated blood with it. So that's the only reason. It's no other reason. It's just like a regular artery. It just happens to be in that position, and so the deoxygenated blood is in it. The red one back here are pulmonary veins, and they happen to be coming back from the lung towards the heart. And since the lung is where you get the oxygen, then it brings the oxygenated blood back. But that's the only reason. It's nothing to do with their structure. It's just the matter of coming towards the heart, leaving the heart. So, behind the pulmonary trunk is this big red one. Notice the texture of the structure. Notice how open those vessels are. That's because the arteries are made of lots of muscle, lots of smooth muscle. And that helps them to stay patent, to be open and thick and strong, because they have to deal with a lot of pressure. Notice especially these ones that are close to the heart. When the blood is ejected under force, it has to be strong enough to deal with that. So that's why they look like that. Here's the aorta has different parts to it. It has the ascending aorta that's coming up. It has the curved area there, that's the aortic arch, and then it has the descending aorta, and it continues to the abdominal and the thoracic aorta. Now, off the aortic arch, which is this curved area, you have two branches. On the cow, that is. On the human, you have 1, 2, 3 branches, and that's what I have on the board. So, the two branches that you have here go back again to your right and left. This is the right side. This is the left side. The one that's over the right side, that one there, that's your brachiocephalic artery or brachiocephalic trunk. You can't see the others because, of course, it's all cut off. When we do the CAT, you'll be able to see those branches up there. So all you can see right now is the trunk area right there. That's this one. This is your right side, and that's this one right here. That's your brachiocephalic artery. The one beside it, because this is the next one, that's your left subclavian on the cow. But here on the human, you have one right beside it. That's your left common carotid, and then the left subclavian is way over here on the left. The left subclavian is always next door to the mouth of the aorta, whether it's on here or it's on here. This is the mouth of the aorta. The left subclavian is always close to it. Okay, so that's what you can see from the front. There's one more thing that I usually do on the model, but it's not because it's not here. It's right here, actually, right here. It's this white thing here. That white thing, it's called the ligamentum arteriosum. You see it? The ligamentum arteriosum. Now, when you're a fetus, that's actually a vessel. Carrie, can you write this on the board? It's called, when you're a fetus, it's called ductus arteriosus. Ductus arteriosus.